Robin, really want to pick your brains a little bit about your experiences. I understand you've been working particularly in Laos and in Timor-Leste, East Timor, in avian flu. Now, Laos has had avian flu. It had an outbreak in 2004, and East Timor hasn't, interestingly. Can you just give us a brief idea of what your job has been in those two places?
I did short-term consultancies for the FAO on assisting the countries with preparedness, with prevention and control strategies, backstopping basically the veterinary services there that are working quite hard.
Okay, let's go first of all to Laos. I mean, how was Laos coping? Laos is a narrow, very poor country squashed between Thailand and Vietnam. I mean, how has Laos been able to cope?
Laos was a closed country for many years and it's only just starting to open up. It has a very small commercial industry. That commercial poultry industry is only located in urban and peri-urban areas. And so what you have is, with the movement of poultry, people still have a preference for village poultry there, and it tends to be a one-way movement from villages into the urban areas and then into the pot. The outbreaks in 2004 were largely limited to those commercial units. They managed to get it under control. And since that time, there have been no official reports of bird flu outbreaks. There may have been some that were not confirmed. But the difference is you don't have the same poultry structure that you have in countries like Vietnam or Thailand, where you have a large number of small poultry producers raising maybe 2,000 birds of commercial breeds.
How has the government itself responded? What have been the key efforts of the government response to bird flu?
Laos hasn't had any vets trained since about 1975. They've got about 9 vets on staff there, and so they're still building their capacity. They've had a lot of support from international agencies. They're trying to set up surveillance schemes, trying to improve marketing, surveillance in markets. But they're working with serological surveillance, basically.
Now, one of the, in our chat before, I mean, what you've just mentioned that doesn't have the vet services, and you said to me that you felt that one of the failures has been this neglect of veterinary services over many years. How does, and this was something that was sort of waiting to happen because veterinary services haven't been strengthened. As I mentioned, my feeling is that there's always got to be this demand for services to build them up, rather than saying that they've got to be there as a gift from above. I mean, where are those demands, and how could this move in Laos?
Partly it's a failure of supporting veterinary services, but partly I think it's a general failure of teaching basic science. I think if we understand basic science, then we're more likely to understand how we need to move and to equip people to make good decisions. So yes, you have underfunded veterinary services. You have veterinary staff and extension staff that have a very difficult, work in a difficult environment. For instance, if you walk up to farmers in Laos and you'll say, have your birds ever been vaccinated? They'll say yes, because what they did was they got an injection. So in Laos, it's very difficult to know what was that injection. Was it a vaccine? Was it an antibiotic? So you have this confusion and a lack of clarity, and that comes into the bird flu work as well. A lot of the messages, a lot of the ideas come out in English or in European languages that are virtually very, very difficult to translate into local languages in the context in which people work. And so it's not just veterinary services, it's primary schools. Who is teaching people about the germ theory of disease? Many of the poultry farmers that we meet don't clearly understand how diseases are transmitted, and all of our control strategies rest on that premise.
No, well, that's a very good point. So, and I think one we'll come back to in this meeting, the importance of other players in terms of, inverted commas, veterinary services. So primary health, teachers you mentioned, and also health workers on human health. Now, you've also got some experience in Vietnam. Vietnam has this concept of information, education, and communication. That's not it's not specifically a Vietnamese project, is it?
No.
But it's been quite successful there?
It's what you have, because they were one of the first countries to really suffer from this. So you've had material developed there to help people share ideas. But what happened was, and I think what's important is that often it's people with veterinary services have had to carry the brunt of it, and we need help, basically. I'm a vet, I grew up on a farm. I'm not a communication specialist. And I think it's with time, as people are now, as Tom said, we're all catching our breath, we're revising things. We need to work with specialists who can help us to communicate better. And just recently, some of the communication material that was put together in Vietnam has been pre-tested by people who are specialists in the field. And there are lessons there that I think we can all learn about how we communicate effectively.
I wanted to pick on that. There was this Patrice Gauthier, I think, in Vietnam, the paraveterinary manual, which has now been translated. I would have thought, getting it from the veterinary people into the other communications health workers, and I think you mentioned that UNICEF have taken this on. How successful has that been?
I think we're still learning, basically. And I mean,
that's a polite way of saying not particularly.
Patrice and the VSF, they produced a manual for very little money. I know there's a lot of money floating around for bird flu, but if you look at the money and the time frame that was given to VSF to produce that manual, it was very short and the money was very small, so they did a good job. But you need to build on it. And the thing about communication material is that you need to be open to comment. You can never get it right the first time. You always need to revise, and you need to adapt depending on who your target group is and the social context and cultural context in which you're working. So I think we're starting to learn those lessons, which is good for veterinary services in general, not just for bird flu.
Okay, but you're saying also that one size doesn't fit all. You can't come up with it. You've got to be thinking of the farmers, the people in the trading industry, etc., and different messages need to be put across. Indonesia. Have you had an experience in Indonesia?
Not directly, no.
Not directly. I mean, Indonesia is the world's worry. 1.3 billion chooks. And the first little cluster potentially of human-to-human flu. Is that a risk beyond all the others in Southeast Asia?
No, and while Indonesia is a concern, I think they are to be applauded because at least we know there are cases. No report of case doesn't mean that there are not cases. So the Indonesian government should be congratulated for actually saying that they've got a problem. And it's put on the background where you have a large number of poultry, as you say, but it's like many developing countries where high mortality in poultry is not a rare event. So it's extremely difficult to identify. In those cases, people are used to their poultry dying. People who keep small flocks of birds, they die in millions all over the world every year, and up until very recently, not many people have taken much notice. So farmers have got used to that high mortality. They have coping strategies, and also they have their own ways of explaining why that mortality occurs, which doesn't always involve the transmission of a virus. So you have to be able to communicate effectively with those farmers, help them to understand that what they're seeing is a new disease, not the old one, where they had their own coping strategies. And so, but they're trying.
You're also, I think, a great advocate of community actions. I mean, we're all given the importance of national surveillance, which is going to be something that we'll be talking about quite a lot. I think we're also worried about regional surveillance to make sure people are talking across borders. But community surveillance and community action, you think, is something very realistic, very practical, something that has got lots of opportunity.
Absolutely. I think most communities, in situations where you have stable communities, they work together. They have their community structure, they have their leaders, and they all know the problems. If it's not bird flu, it's Newcastle or something else that comes in. When one new bird comes in and they all wipe it out, they know it's a problem. And by sitting down and working with people together, they're quite happy to try and institute quarantine measures, to try and institute community-based control strategies, and I think that has great potential, which will not only stop bird flu, but actually increase the number of birds, reduce general mortality, and improve people's income and food security.
Robin, thank you very much.